Everyone. Welcome to OET Listening Prowess, and this is Divya Benny from 𝐀𝐝 Academy. How are you guys? Are you all doing good? So last week we had a session on listening of OET listening on Part C. Today I've come up with another extract of Part C. Okay? So preparations okay, exams how is it going so far? I hope everything is going good. So today, as I already mentioned earlier, I'll be discussing Part C. So let me just start with few information regarding what exactly is Part C. I know everybody do have an idea regarding Part C. So, what type of information is Part C? As you know, Part C has 6 questions each, and we have 2 different extracts that is going to be either an interview or a presentation. Okay? So, let me just give you an idea regarding the type of questions that you can expect over here. Mostly, we have to find out whether, or we have to find out the type of question. That is, either it's going to be an opinion or either it's going to be an attitude. So let's just wait for a few minutes so that others can join, and we'll be starting right away afterwards. So the question will be displayed on the screen for you now. Okay. So as I already mentioned, I hope the question is clear for you. So as I already mentioned, it's going to be an attitude-based question or an opinion-based question. So let me just give you a brief idea regarding what is an opinion-based questions. So basically, we'll be asking for the viewpoint of the speaker, or it can be their thoughts, or it can be their personal judgments on a particular topic. And this often include words like think, you can expect the words like believe, suggest, or even feel, or even opinion. So if you are able to listen to any of these words during your listening or during the audio, you can ensure that that's going to be an opinion-based question. Okay? Now, what exactly is an attitude-based question? Attitude-based question means you have to focus on the speaker's feeling or emotional stance towards a particular subject. Okay, so these questions often require understanding tone, your choice of words, and the implied meaning of the same. Okay. And apart from that, you can also expect a fact-based questions. So basically, you'll get an idea regarding the specific details. Hi Roshna, good evening. Welcome. I was just chatting with a few information. So coming back, the fact-based question is going to be asking about the specific details or any observation mentioned by the speaker. And this answer is usually a concrete piece of information. Okay. Or you can even say that it's going to be a direct statement which can be identified from the audio. Hi Neeta, good evening. Yes. So let's just start directly with the questions. So you can, I hope the question is clear for you. Good evening, Divya. Good evening. Okay. So here the question is, hi Megha, good evening. Here it's an interview, right? You hear an interview with Dr. Tabitha Hussain, who is talking about treating the patient with cystic fibrosis. So you are having an idea regarding that's the background information. So you are already having an idea regarding how many type of speakers are there in this question. As it is an interview, you do have an idea that we can expect 2 person, right? 2 person is having a conversation, and one is Tabitha Hussain, and they are specifically speaking about treating the patients with the cystic fibrosis. Okay, so let me just start with the first question. So the question is clear. I feel that the question is clear for you. So the first question is, Dr. Hussain says that patient with cystic fibrosis. That is the statement, right? So now tell me regarding the keywords that you will be marking in this particular question. So to comment the same, I would like to know what is the particular keyword that you are planning to include over here. Along with that, mention whether that's going to be, what is the type of question. It's going to be an attitude, opinion, what exactly it is. So please do mention these things in the comments. I would like to know. So tell me the keywords, along with that, the type of question it is. So I would like to know regarding the same. So the question is, Dr. Hussain says that patient with cystic fibrosis. So basically, doctor is trying to say something related to the condition about this patient. And we have three options. May find the side effects alarming. The option B is tend to require treatment from a young age. Then can improve their condition with frequent hospital visits. So first option, it's stating that the side effects can be alarming, or the doctor is claiming that the patients with cystic fibrosis, they might find the side effects is alarming. Second one is they have to start with the treatment at a very young age, okay? And the third option is can improve their condition. If they are having a frequent hospital visits, they'll be able to get this improvement in the condition. Yes, yeah, okay, Roshna has mentioned patients and cystic fibrosis. So you are right. Patient and cystic fibrosis. Is there any other keywords that you are planning to include over here? Anyone else? Which one do you think? Any other keywords? Tell me the type of question. It's going to be an attitude, opinion, or whether it's going to be a fact-based question. Let me know. Which one do you think? Okay. So your type of question you can expect over here is it's going to be more an opinion-based question. Okay, now can you tell me regarding how will you come up with an opinion-based question? How will you come up with an opinion-based question? Or how will you understand that that is going to be an opinion-based question? So what exactly is they stating? Here you can see the question is asking about what Dr. Hussain says. You are able to see that, right? About patient with cystic fibrosis. So basically that is more like general viewpoint of this particular person or her belief concerning the patient. So whether they find the side effects alarming or require this early treatment or even benefits with the hospital visits. So the word says is implying that it is based on more of her observation, or it is more like on her perspectives. It is not going to be an absolute fact, which is why this question, the type of question here, can be an opinion-based question. So basically, she is claiming her viewpoint, or what does the cystic fibrosis patients who is having cystic fibrosis thinks. So basically, what they are mentioning is it is commonly based on the perspective of the doctor. So that is what mentioned over here. So now let's look at 32nd question. So what does Dr. Hussain say is difficult when treating patients who are not in hospital? So what do you mean by that? What do you mean by that? What do you mean by that? So they are trying to say, or what she is trying to say, which is something which is actually really difficult while patient who is not being in the hospital for the treatment. So tell me the keywords that you're planning to imply over here. Tell me the keyword. Which one do you think is the keyword? And along with that, do mention the type of question, whether it's an opinion or an attitude-based question. Tell me regarding the same. Okay. Here, which one do you think is the keyword? Difficult. Okay. Megha has mentioned that one thing is difficult. Any other information? Treating. Okay. Apart from that, which one do you think? Which one do you think? Difficult, not in hospital. Okay, that can be. Yes. So what do you think? Is it going to be an opinion-based question? Or, okay, Atulya, difficult, treating patient, not in hospital. Yes, you're right. Yes, treating patient. So these are difficult is there, and treating patient, not in hospital. That is going to be your keyword over here. Okay, so now tell me, what is the type of question? Is it going to be an attitude type of question or an opinion-based question? Okay, yes, Megha, not an hospital. That is another keyword that we just mentioned over here. Okay. What do you think? Is it going to be an attitude-based question or an opinion-based question? Opinion. Yes, Megha, you're right. It can be an opinion. So why opinion? Again, here we can see that the question is asking for Dr. Hussain's view on difficulties in treating outpatients. So basically, we are seeking her opinion on the challenges she faces or perceives, which means subjective. Maybe while I am, treating a patient, I might be finding difficulty in treating patient in certain aspects, or maybe I might not be finding it difficulty. Here, Dr. Hussain has found out that this is particularly difficult for her. Yes, so Atulya, it's going to be an opinion. So the word difficult suggests that this is a matter of a perspective rather than an objective fact. So which is why we are thinking that this can be the particular reason. Okay, so now how do you approach this question? So you can try to pay attention to any challenges or any difficulties that will be mentioned when treating outpatients. So you have to closely observe that. Maybe, for example, they can be particularly mentioned regarding any reasons or any examples of what Dr. Hussain gives. Maybe Dr. Hussain might take a particular patient as an example, while maybe, for example, the patient named Sarah she was treating the patient named Sarah and she was finding it difficult. So suppose you can expect such answers. Okay. Now, is there any particular information you would like to eliminate over here? So while you listen to the audio, remove choices that do not address the challenges or any difficulties faced by the patient outside the hospital. Here particularly mention who are not in hospital. So basically, remove choices that do not address the challenges, difficulties faced by patient outside the hospital. So you can try to understand which one is going to be accurate. So keep this in mind while you listen to the audio of the same. Now moving forward with 33rd question, what does Dr. Hussain say about the role of distraction therapy in cystic fibrosis treatment? So tell me the keywords over here as well as the type of question. Do comment the same. I would like to know. Which one do you think is the type of question over here as well as the keyword over here? Which one do you think? Okay, so what is the question stating? Dr. Hussain is trying to mention about the role of particularly distraction therapy in the treatment of the cystic fibrosis, and we have three options. First one is mentioned that it can be related to the treatment being provided. Second one can be mentioned that it is allowing the patient to complete their activities more quickly. What is allowing? Basically, if there is a distraction therapy is included, they are able to treat everything properly. Yes, Megha, you're right. It's opinion based, and the keyword she has used over here is distraction therapy. Yes. Roshna, distracting therapy. Yes, cystic fibrosis. That is some other information you can include. Cystic fibrosis treatment. Okay. Role treatment. Yes. Okay. So that's an opinion based question. Okay. Yes, Reba. Okay. So why did you come up with that's an opinion based question? Is there any particular reason behind you chose the same as an opinion based question? Is there any particular information? So here the focus is basically on the Dr. Hussain's view of the purpose or function regarding the distraction therapy, right? And you can expect that it might involve some of the factual information. Basically, ultimately what they're trying to do, asking for how she perceives its role in treatment, making it more about her professional opinion. So basically, the person is asking for what Dr. Hussain say about the role of distraction therapy, and she is going to speak on the perspective of her. Yes, Megha, that's going to be role. Okay, so now how do you approach? Focus on the explanations or discussion regarding the distraction therapy. Maybe you can try to look for the benefits, the purpose, or maybe you can expect some of the examples over here. Okay. Hi, Reenu. Good evening. Okay, now, is there any particular information you would like to eliminate over here? you can try to exclude any information which is not aligning with the stated or implied purpose of the distraction therapy. Basically, you have to focus on what is the actual role of distraction therapy. So if you feel like this is not actually aligning with the meaning of the distraction therapy, you can eliminate that particular information. I hope it is clear so far. Is it clear so far? Okay, so listen closely regarding all these information to get an particular information. Okay, so now let's move forward with the 34th question. So what changes did Dr. Hussain observe in one of her patients? So tell me the keywords over here. Which one do you think is the keyword over here? And also whether it's going to be an attitude-based question or an opinion-based question. Tell me. So we have 3 options over here. He showed respiratory improvement. So basically, the particular option is stating that this patient or he has observed that maybe particular patient were able to show some respiratory improvement, or particular patient's condition was rapidly deteriorated following a change in the treatment, or maybe he began to enjoy the aspects of the treatment. So which one do you think is the keyword? Yes, Megha, you're right. Changes. Anything else apart from the same? Changes observed. Okay, Roshna. Yes, Abdullah. Changes. One of our patient. That is very important over here. So now tell me the type here. Which one? Which one is the type over here? Is it going to be an fact-based or attitude or opinion? Which one do you think? It's more like an opinion, right? Yes, that is basically because it's basically we are observing, right? Or it's more like a fact-based. So this question is actually asking for any specific observation that is Dr. Hussain made about a patient's condition, right? So it should be requiring a factual answer, and it should be based on what she has directly observed, right? Rather than what she thinks or feels about the situation. That is aware. Why it is not more like think or feels about the situation? Because she has actually took a patient over here and she has observed this particular patient's condition. So which is why we have mentioned regarding it's more like it requires a factual answer which was directly observed. It's not like she feels about it, she has observed this patient's condition. Okay, so now what is the approach? You can identify specific changes that she mentions in her patient. So these can be usually a factual observations, and you can which is the information you will be trying to eliminate over here. You can try to disregard any answers which is not mentioned as changes which Dr. Hussain has observed. Okay, so if you hear specific information which she means the speaker, that is Dr. Hussain, has not observed, that means you can eliminate that particular answer. Clear so far? Okay, now let's move forward with the 35th question. So Dr. Hussain plans to use technology to help cystic fibrosis patients to communicate. So tell me the keyword over here. Which is the keyword? Which is the keyword? Any particular keyword that you've noticed over here? So here she is planning to use about a particular technology which will be definitely helping the cystic fibrosis patient to communicate about specific thing. What exactly is the same? We have 3 options with other patients who suffer from the condition. So basically the technology can help the other persons or patients who do have the condition. Next one is with family members. So the technology will be helping the family members who are unable to visit the hospital. Then with patients of a similar age suffering from different conditions. So the particular technology will be helping specific age group where they are suffering from the different condition. Okay, make a plan. Yes, you're right. Plan is there. Yes, Roshna. Use technology and communicate. That's going to be your keyword. I've already mentioned on our previous sessions as well. Do not underline each and every other information. Specifically focus on the keywords. Why do we have a keyword? Keyword will help you to get into your answer, or you will be able to listen to particular information. So you are able to listen a lot of information. So this particular word will help you to understand or identify which is the same. Yes, Adulya, communication. Yes, you're right. Okay. Now, what is the keyword over? Sorry. Now, what is the type over here? Which one do you think is a type over here? Is it going to be an opinion or any attitude? Which one do you think? Is it going to be an opinion or an attitude? Yes, Reba, technology help communicate. You're right. You're right. Do you think that's going to be an opinion? Yes, Megha. Why opinion? Because that can be a future action. Adulya, attitude. Okay. Why do you come up with an attitude or an opinion? So more than attitude, I would suggest this is more like an opinion. Why? Because the question is involving on Dr. Hussain's future plan, which is usually based on her opinion on or strategy for the improvement. So the focus here is what she plans to do, which involves her intention or decision. So basically an opinion on how to use this technology. So what is the question? Dr. Hussain planned to use technology to help. So what is she planning to use, or how is she particularly going to help? So that's basically her way of attempting. Maybe if there is another doctor who is planning to use this particular technology, the particular doctor might be using the technology for rather than communication, maybe they might be using the same for another purpose. Okay, I hope that is clear for you. That is what I was trying to say over here. So what you can try to, how do you approach this question? You can try to pay attention to any plans or any strategies which is involving the technology. Okay, along with that, you can try to listen for who the patients will be communicating with. So you have already mentioned in the question the communication can happen with the family members. It is mentioned that it can be helping similar age. So you can try to find out what exactly they are trying to focus. Now, which one do you, or which information you can try to eliminate? So you can dismiss any option that is not fitting in the context of the communication purpose. That is particularly. So if you feel like the particular information is not focusing on communication purpose, then and there you can eliminate that particular option. I hope it is clear so far. Now, the next one, 36th question. Dr. Hussain suggests that future treatment for cystic fibrosis. Now tell me the keywords over here, as well as what is the type of the question you are planning to include. What is the keyword over here? So the doctor is actually trying to suggest about the future treatment. So 3 options we do have. Future treatment, Atulya, yes, you're right. Future treatment. Anything else? Any other keywords? Tell me the type of question over here. Which is the type of question over here? So we have 3 options over here. We'll always incorporate lengthy procedure. What will we incorporate? Yes, Divya, future treatment. Which or what do you think is going to be future treatment? Cystic fibrosis. Yes, you're right, Roshna. You have another keyword over here, that is cystic fibrosis over here. Adulya, you're right. That's going to be an opinion. Why did you come up with that is going to be? Yes, Divya, that's going to be opinion. I've mentioned while we start the session, the word suggest is actually indicating that is about what Dr. Hussain might think can happen in the future concerning the treatment. That is why. So basically it is her prediction or an education guess based on a professional knowledge, making it an opinion rather than any factual statement. Okay. So you, Reba, yes, the future treatment and cystic fibrosis. You are right. So we have 2 keywords over here. Now the approach. How do you approach this question? So you can try to listen for any future oriented statements or any particular predictions about the treatment. Okay, about the treatment. And how can we eliminate any particular information? You can try to eliminate options which is not aligning with the forward looking statements made by Dr. Hussain about the treatment developments. Okay, so you have to understand regarding which information is not going to be aligned over here. Okay, so closely listen to the same, and as I already mentioned, we do have paraphrased information over here. So why do we have paraphrased information over here? You might be listening to the same information, but it can be slightly different from the options. So always expect for a paraphrased information. It can be slightly different. Try to find out which is going to be accurate enough. So now we can do the audio, right? So I'll be playing the audio for you. Try to find out the answer.
You hear an interview with a physician called Dr. Tadita Hussain, who's talking about treating patients with cystic fibrosis. Cystic fibrosis is a condition that causes mucus to be thicker and stickier than it should be. Dr. Tadita Hussain specializes in cystic fibrosis treatment and is here to share her thoughts on caring for people with the condition. Tadita, can you tell us a bit more about patients who suffer from cystic fibrosis?
Absolutely. Sufferers tend to carry 2 to 5 times as much salt in their bodies as those without the condition, so you can see why their mucus is thicker than average. Treatment for these patients is usually quite time-consuming and repetitive. Patients are often required to stay in hospital for long stretches, and as the symptoms of the condition begin to present very early on in the patient's life, many of my patients are young people, and so we tend to see lots of patients with cystic fibrosis finding these hospital visits frustrating.
Right.
In fact, throughout the UK, about 80% of patients with cystic fibrosis who are hospitalised report feeling at least minimal levels of depression.
How about young patients who aren't currently hospitalized? What can be challenging about their treatment?
Well, patients can be required to take around 30 pills a day to keep cystic fibrosis under control. So it's understandable that teenagers and young people who just want to be free and independent might resent this ordeal if they think they can get away with it. One of the most difficult things we have to contend with is the fact that if patients stop taking their medication or doing their daily breathing treatments, their condition won't immediately worsen. Instead, it will gradually become more severe until they contract a serious infection, which puts their lives at risk.
So, what approaches do you use when treating patients with cystic fibrosis?
Well, we've found distraction therapy to be extremely useful. We're incredibly lucky to have received a donation of a number of virtual reality headsets following their success in a number of treatment trials. We use the virtual reality headsets to transport the patient to outdoor settings, often corresponding to the activities they're required to do with us. When they complete breathing exercises on a stationary bike, for example, the VR headsets display a virtual outdoor bike ride. Our patients find it helpful to pretend to be somewhere else during treatment, and it's often easier for us to administer breathing treatments to patients using these headsets, as they're more relaxed when they're not focused on the actuality of the test.
So, what sorts of changes have you seen in your patients as a result of these methods?
One of my patients, a 24-year-old man with cystic fibrosis who was in hospital waiting for a lung transplant, well, he found treatment very difficult at first. He was preoccupied by his need for a transplant and frustrated by feelings of powerlessness. He would often resist treatment. We started using the virtual reality systems with him as soon as we got them, and it took a while for him to get on board, but when he did, it was like someone had breathed new life into him. Not only did he stop hindering his treatment, he actually began to look forward to it. He's even started helping us to think about other ways we can improve the experiences of our patients, like improving social interaction.
Yes, I understand that there are difficulties involved in patient communication.
We're looking into the possibility of instant messaging functions between patients, and even virtual games that they can play against each other. Unfortunately, patients with cystic fibrosis have to be kept apart to avoid cross-infection. It's just one more cross to bear for our patients, that they can't talk to those going through the same thing.
Right.
Our patients get plenty of interaction with myself and the rest of the staff, but we'd like to make sure they have access to a network of fellow sufferers too, for support and advice.
I see. That all sounds quite futuristic. Are there any other advances on the horizon for the treatment of cystic fibrosis?
Well, there's a new drug that's been in the news recently. It's a combination of 𝐒𝐿 and ivacaftor. You might know it by the brand name Orkambi. The drug works by improving the level of water and salt in the body, thereby reducing the thick mucus that causes illness and respiratory issues in those with cystic fibrosis. Even more exciting and futuristic, though, is the possibility of gene therapy, where the genetic mutation that causes cystic fibrosis in individuals is replaced with a healthy gene. This would effectively cure those with the condition and significantly extend the lives of thousands of people and remove the need for lengthy stays in hospital.
Yes, how was it, guys? Was it easy? Were you able to locate the answers just like the way we actually discussed? How was it? Was it easy? It should be easy. Okay, let's just discuss the answer. I'll be mentioning the options for each questions. So 31st question, the answer was B. Did you get the answer as B? I hope everybody got the answer as B. Do comment the same regarding. So 31 was B, and 32 it was C. Okay, 31 was B, 32 was C. Then 33 was A, and 34 was C, 35 was C, and 36 was B. So tell me, how much were you able to score? Were you able to get 6 out of 6? How was it? Were you able to get 6 out of 6? I would like to know regarding the same. Yes, do try to comment the same. How was it? So 36 was B. Okay. Okay, let's just start with the discussion of the same. As we just mentioned that 31st question, your answer was B. And I hope everyone were able to get the score. Atulya 4, not bad. Good job. Next time onwards, try to score all 6. Others, were you able to get the answers? Roshna 4, good. Jissa 5, very good. Did anyone score 6 out of 6? Any particular person? No one? No worries. We'll be able to make it next time. Okay? Yes. So without any further delay, let's start with the discussion. Okay. So the first question was Dr. Hussain says about the patients with cystic fibrosis. So I've displayed regarding the transcript. So the question was, can you tell us a bit more about patients who suffer from cystic fibrosis? And the doctor has specifically mentioned Jissa 5. Yes, Jissa, good job. Absolutely, sufferers tend to carry 2 2 to 5 times as much as salt in their body as those without the condition. So you can see why the mucus is thicker than average. Treatment for this patient is usually quite time consuming and repetitive. Patients are often required to stay in hospital for long stretches, and as the symptoms of the condition begin to present very early on the patient's life, many of my patients are young people, and so we tend to see lots of patients with cystic fibrosis, finding these hospital visits frustrating. Right. In fact, throughout the UK, about 80% of the patients with cystic fibrosis who are hospitalized report feeling at least minimal level of depression. Okay. So here, what was the doctor trying to say is about the patient who is having the cystic fibrosis? So our answer was tend to require treatment from a young age. So may I find the side effect alarming? Did the particular portion was explaining about any side effects? Did you see any particular side effects over here? Treatment, the patient here, we can see that they were focusing on the treatment and also regarding the symptoms, but did you see any side effects was finding it alarming? No, right? No. So then, can improve their condition with frequent hospital visit. What does it mention? Can their condition be improved with frequent hospital visits? What do you think? Here it is mentioned that the hospital visits is more like frustrating for them, and they have specifically mentioned that 80% of the patients with cystic fibrosis who is hospitalized report feeling at least minimal level of depression. So basically, once they are getting admitted, they do have another piece of thing, that is depression over here. So now tend to require from a young age. So that is a paraphrase sentence over here. So what is mentioned over here? Here it is specifically mentioned that see, the treatment for this patient is consuming and repetitive, and they have to stay in the hospital for a long stretches. So why long stretches? The next sentence we can see, symptom of the condition begin to present very early age. As the condition begin at the very early age on the patient's life, many of the patients are young people, so it is going to be really important for them to start with the treatment as an early age, which is why it is mentioned as the condition is there from the patient's early life. Many patients are young people, and they have to require that, they tend to require a treatment even though that might be frustrating. So basically he is trying to say that patient with cystic fibrosis do require the treatment from the young age, and he is not particularly mentioning that the condition can be improved with the frequent hospital visits. It can be improved, but that is not something which he is currently stating over here. Okay, I hope that was clear for you. Now the next question was, how about the young patient who aren't currently currently hospitalized? What can be challenging about the treatment? So what does Dr. Zen say is difficult when treating patients who are not in the hospital? So the answer was they don't understand the importance of the treatment. Why they are not able to understand the importance of the treatment? Because it is mentioned that the patient requires around 30 pills a day to keep the cystic fibrosis under control, right? And it is also mentioned that it is understandable that these teenagers and young people, as I already mentioned, the most of the person who do have this condition will have it at their young age. So they just want to be free and they have to be independent. So they think that they can get away with it. Okay, so one of the most difficult things we have to contend with is that fact, if the patient stop taking their medication or doing their daily breathing treatments, their condition won't immediately worsen. Instead, it will gradually become more severe until they contract a serious infection, which can put their lives at risk. So they often find the exercises too complicated. Was that the option they have mentioned over here? No, they are not mentioning about any exercises over here, are we? Are you with me so far? Why am I unable to see anything on the comment section? Are you with me so far? Okay. So yeah, we are not finding the exercises too complicated. Did they particularly mention anything regarding the same? Did they particularly mention? Guys, do comment the same. I would like to know whether you are with me so far. Okay, then they tend to have difficulty socializing with the other people. They are not mentioning that they are finding it difficult to, socialize with the people who are not hospital. No, they particularly mentioned that these particular persons do not understand the importance of the treatment. Yes, Adilya, thank you for responding. Yes, why they find it difficult? Because as they are very young, they would like to be free, and they once they stop taking medications, or if they are doing their daily breathing, if they are not doing their daily breathing treatment, their condition won't immediately worsen. What will happen? Instead, they will become, or the condition will gradually become more severe until they contract this serious infection. So which is why he is stating that it is going to be difficult when they don't give the importance to their treatment. Okay. Now the next question was, what does Dr. Hussain say about the role of distraction therapy? Okay, and the answer was, it can be related to the treatments being provided. So here what is he mentioning? We found distraction therapy to be extremely useful, and he is stating that he feels very lucky to have received a donation for a number of virtual reality headsets following their success, and he is mentioning that they use a virtual reality headset to transport this patient to the outdoor settings. And when they complete this breathing exercise on a stationary bike, for example, he is telling the VR headsets display a virtual outdoor bike ride. So the patients are finding it helpful to pretend to be somewhere else during their treatment. And also it is clearly stating they are finding it easier for us to administer this breathing treatments to the patient using these headsets, as they are more relaxed when they are not focused on the actuality of the test. So it allows patient to complete their activities more quickly. Is it mentioning something like that? Are they mentioning something like that? What are they particularly trying to mention over here? What are they trying to particularly mention over here? Yes. So what are they trying to? Okay. Yes. Sorry for the inconvenience. We just had a technical glitch. Okay. So coming back, what are they trying to mention over here? So here we can understand that it can be related to the treatment being provided. So here they are particularly stating regarding the treatment that is provided, or it allows patient to complete. No, it is not actually, just because the distraction therapy is there, it is not going to help them to complete their activities more quickly, or it provides staff with more information. No, it is not particularly stating that it is going to give more information regarding the patient's conditions. It is clearly mentioned that the role in distraction therapy in cystic fibrosis treatment, what is happening? So they are particularly stating that they use this particular stationary bike, so and so and so. What will happen? And the patient is finding it difficult to pretend to be somewhere else during the treatment, and it is also often easy for them to administer the same. So it is going to be related to the treatment being provided. So the role of distraction therapy is, it can be related to the treatment which is already provided for them, but the thing is that it is going to be extremely useful for them. That is what they are trying to say. Now, are you clear so far? I hope it is clear for you. Now the next question was, what changes did Dr. Hussain observe in one of her patients? So he began to enjoy the aspect of their treatment. That was the question, right? So now tell me regarding what sorts of changes have you seen in the patient as a result. So here, while we discussed earlier, he is particularly stating that one of his patients was a 24-year-old man with the condition, and the patient was having or waiting for a lung transplant and he found treatment very difficult at first. So remember, already stated that he was finding the treatment difficult at the first. Why? Because he was already preoccupied by his need for a transplant, and he was frustrated by the feelings. Already it is clear regarding how the patient is feeling, okay? And it is also mentioned he would often resist treatment, okay? And what did they use? Dr. Tadita has started to use this virtual reality systems with him, and as soon as we got them, and it took a while for him to get on board. What does this get on board means over here? What do you mean by that? What is the other paraphrased meaning you can expect over here? Which means he is coming to that particular track of the same. What is he coming? Basically about the condition, right? Or the treatment. So, but when he did, it was like someone had breathed new life into him. Not only did he stop hindering his treatment, he actually began to look forward to it. There is our answer. Okay, he's even started to helping us to think about other ways we can improve the experience of our patients, like improving. So what he didn't even hinted on regarding the treatment after he started with the same, he also even started to help doctor regarding how other patients can improve the experiences. Okay, he showed respiratory improvement? No. That was not something which was observed. He deteriorated rapidly following. No. Deteriorated? No. His condition was not deteriorated. What? He began to enjoy aspects. So initially he was frustrated, but later on he was really okay with the treatment. So that might be easy for you because it was very direct. I hope you did get the answer correct for the 34th question. Did you get the correct answer for 34th question, or did you confuse with any other option? I hope you didn't confuse the answer. Okay. Now, next question, I'm just moving forward. What Dr. Hussain plans to use technology to help cystic fibrosis patients to communicate. So the question is, she is going to use this technology to help cystic fibrotic patients. Again, our answer was with the patients of a similar age suffering from different condition. What does that mean? What does that mean? So basically, ഈ പറയുന്ന cystic fibrosis എന്ന് പറയുന്ന അതിനെ help ചെയ്യാൻ വേണ്ടി technology use ചെയ്യുമ്പോൾ many patients of the similar age are going to be helped with different conditions. So, okay. So we are looking into the possibility of instant messaging functions between patients and even virtual games that they can play against each other. Unfortunately, patients with cystic fibrosis have to be kept apart to avoid cross infections. So they are unable to make a proper communication because to avoid cross infection. So it is just one more cross to bear for our patients that they can't talk to those going through the same thing. So basically, if I'm having this condition and if you are having the condition, I'm unable to make a direct conversation because of the infection thing. Okay. So our patients get plenty of interaction with myself. Who is this particular patient? With the doctor and rest of the staff. But we would like to make sure that they have the access to a network of fellow sufferers to support and advise. Basically, the patients are able to have a communication with the healthcare professionals, but they're unable to have a conversation with the people who does have the same condition. Okay, what is the same thing? What are we trying to? With other patients who suffer from the communication. What does it mention over here? Are they mentioning about with family members who cannot visit them in the hospital? No, they are not mentioning anything regarding the family members over here. Now, yes, what is here stating? What does that mean over here? Okay, here the answer was supposed to be 35th question was A. That was a mistake from my side. It was not C. Okay, so it was supposed to be A over here. So it is clearly mentioning that they are actually having a communication with the person, or they would like to have a communication same age. Okay, why same age? It is mentioned that they have to access to fellow sufferers. Fellow sufferers is mostly not going to be, you can even consider that it can be a same age group. Sometimes that cannot be. So I would suggest it should be 35th question. Yeah, similar age suffering from different conditions. So why here we can consider that as the patient is young, that is one of the reason why they are telling it will be EC. So that is why with patients of similar age suffering from different condition, so that it will be helping them to communicate with the same. Okay, so they are properly communicating with the patient who does not or who are unable to have a conversation with the others. Okay, they are just having a communication with the staff, so they have to make sure that they have the access of network of fellow sufferers too for support and advice. Okay, so fellow sufferers means whoever who is suffering with the same condition, so that can be considered as same. Okay, now yes, Dr. Hussain suggests that future treatment for cystic fibrosis. So what was the answer? Could prevent breathing difficulties. So well, there is a new drug. They are mentioning about a new drug which is a combination, and the drug is working by improving the level of water and salt in the body, so thereby reducing the thick mucus that cause illness and respiratory issues in those with cystic fibrosis. And even more exciting thing and futuristic thing is that possible of gene therapy, and this would effectively cure those with the condition and significantly extend the lives of thousands of people and remove the need for lengthy stay in the hospital. Okay, so could prevent breathing difficulties in sufferers. That was our answer, right? So we'll always incorporate lengthy procedures. So basically, why is Dr. Hussain suggesting this future treatment? Any particular thing? Why would he? Okay, yes. Why would we try to go for the same? So why do you think? Are there any advances on the horizon for the treatment? Horizon means going up and off. So what does that mean? Will always incorporate lengthy procedures? No. Here it is clearly mentioning remove the need for lengthy stay. So that is not the same. This procedure will help them to provide with any sort of what? Any sort of? Yes. And now what exactly is the next one? Might be less painful than current options available. What is this mean? What does that mean? Is it particularly mentioned that it is going to be less painful? It is mentioned? Is it mentioned? So basically, could prevent breathing difficulties. Yes, they have mentioned clearly regarding the same. It will effectively cure those with the condition for the significantly extend the lives of the thousands of people, right? Now, how will we be able to understand? So it is mentioned causes illness and respiratory issues, which is why we have come up with this particular information. Okay, so I hope it was really clear for you, each and every other informations over here. If you just listen carefully regarding all the three options, and if you are able to understand the paraphrase meaning, it will be easy for you. So part C should not be difficult for you. Ensure that you're practicing everything on daily basis, and you will be able to understand each and everything and try to improve your vocabulary. Okay, and also focus on the accents. You'll be able to listen to different type of accents which will be helping you. So do you have any questions about what we discuss? Anything? Thank you, Atulya. Yes, thank you. It was helpful. Always ensure that you're going for this attitude, opinion-based keywords, which will be easy. And as this is an interview, it will be much more easy because we have two speakers. So always listen for the switch. So yes, that's for today. We'll meet next week. Thank you and good night.